If things in your knee were functioning properly, then you would not have the potential for arthritis in your knee to develop, number one, as quickly, as early on in age, number two, ever really progress, etc. So there's really 5 things in your knee joint that help to protect you. The first is, surrounding your knee joint, you have what's called a capsule. Every joint in your body has a capsule. So everywhere where the 2 bones come together, there's a capsule. It's like saran wrap that surrounds that joint. Now in all of us, that capsule needs to be the right balance between being just tight enough to prevent slippage and too loose where it allows too much slippage to occur. As we age, the capsule in the joint starts to get a lot looser, and it allows the knee to slide a lot more. So that capsule loses some of its elasticity, some of its strength, and it becomes a little bit more limp and a little bit more loose, and so it allows more slippage to occur. The second thing in your knee that would work to prevent arthritis are the ligaments. Again, because you have this flat bone and this round bone, you rely on 2 ligaments in your joint called the ACL and the PCL to prevent forward and backward slippage. And then you rely on your MCL and your LCL on the side to prevent side-to-side slippage. In all of us, our MCL and our LCL are very long ligaments, and a longer a ligament is means that it has a lot harder time stabilizing. So for starters, the side-to-side shifting, even in a teenager who doesn't have any yet signs of arthritis, the side-to-side slippage is much greater than the forward and backward slippage. And then as we get into our early 30s and into our later 30s and early 40s, all ligaments in our body start to get a little bit looser, a little bit less taut. And so that allows for some forward and backward slippage in the knee and some side-to-side slippage in the knee as well. The next thing in your knee that protects your knee and tries to prevent it from experiencing arthritic changes are the muscles around it. So again, in your knee, you have 2 big muscles, the muscle on the front of your thigh called your quadriceps, and the muscle on the back of your thigh called your hamstrings. In most people, they are pretty strong, and so they prevent the forward and backward slippage, because the hamstring along the back side will prevent the forward slippage, and the quadricep along the front side would prevent the backward slippage. So again, arthritis occurs because there's too much movement in the joint, and so you get this forward and backwards or side to side, but the quadricep and the hamstrings are ideally set up to prevent that forward and backward slippage. But from a muscular standpoint, there's not a whole lot, again, to prevent that side to side slippage. And so most times what we see is that arthritis in the knee begins to develop as a result of the side to side slippage of the femur, the bone in the upper leg, on the tibia, because you don't have good strength coming out of your hip muscles like your gluteals, your abductors, your piriformis, your adductors, other small muscles in your hip called your gemelli and things like that. And those muscles aren't stopping the side-to-side slippage, which allows the friction, which wears away the cartilage and begins the process of the arthritis setting in. In addition to that, the fourth thing that ideally muscles should have is good flexibility. So whether we're talking about the hip muscles or your quadriceps or your hamstrings, the longer a muscle is means the less pressure it's going to create in the joint. The shorter a muscle is, it's going to close up that joint space, it's going to put more pressure on that cartilage and therefore start the process of wearing it away and exposing those nerve endings much earlier in life. And the last thing that gives the knee some protection and tries to prevent it from experiencing or developing arthritis is your kneecap. So on the front of your femur, you have this groove, and your kneecap is supposed to fit into that. And when you bend and straighten your knee, that kneecap should slide straight up and down in that tunnel. In most people, what it does is it shifts side to side as it's going up and down. And that is a condition called patellofemoral problems, but that side-to-side slippage means that the lower leg is also sliding side-to-side at the same time. So at the same time that kneecap is sliding and creating wearing on the back of the kneecap, you're getting a side-to-side slippage of your tibia, and again, that's what begins to wear away that cartilage and start to cause arthritic problems. Arthritis starts early on in life. It probably starts to some degree if you're very active as a teenager. You start getting a little bit more friction, you're very hard on your joints, you play a lot of sports, you do a lot of activities, etc. And you start to create that a little bit of wearing on those surfaces. So if we're looking at the knee in general, you're beginning to wear that cartilage just a little bit. And what happens then is that you start to experience that tightness and that stiffness. So understand, those are the signs of arthritis. It is very possible to prevent arthritis from getting worse, but you can't reverse anything that's happened. So the earlier that you start addressing those symptoms, those signs and symptoms that I just mentioned, the stiffness, the aches, the swelling, etc., and prevent it from getting to a point where you've actually killed off the nerve endings, the earlier that you start to address that, the easier it is to prevent it from getting worse and stop it from having a negative effect on you. Because the last thing we want is for anybody to end up needing to have a joint replacement or a knee replacement. So again, you can prevent it from getting worse, and that's really where physical therapy comes in. We can help you to be active, we can help you to have this arthritis in your joint, but have it not affect anything. And how do we do that? We make sure the capsule is doing its job. We make sure the ligaments are able to do as much work as they can. We make sure that the muscles are strong enough to make up for what the ligaments don't do, and that they stop all of that slippage from occurring. Muscle can be strengthened if strengthened appropriately, correctly, and in the right balance of each other, and getting your hip muscles along with your quads and your hamstrings. We can make your knee be just as stable as it ever was and undo the further effects that any arthritis would have. We can make sure then that muscles are nice and loose and stretched out the way that they need to be, and we can most importantly make sure that your kneecap is tracking the way that it should, and all of that works together to stop all of that slippage, which ultimately is what causes the pain. So again, physical therapy and the expert physical therapists here at Loudoun Sports Therapy Center can help you with that. We can get it all started by doing an assessment on what is causing your problems, figuring out exactly what of those 5 things is causing your arthritis, figure out if it is arthritis, and if not, figure out what needs to be done to handle it. And when we determine that it is arthritis, and you don't need an x-ray to figure that out, you can figure out arthritis by looking at those 5 things, seeing one of our expert physical therapists, getting everything assessed, figuring out if it's arthritis, and then getting you doing the appropriate things for it, and we can definitely help you to get it under control and get back to living life and being able to do the things you want to do without arthritis causing you to have problems.